What happens when a woman gets wet? Ever wonder why you get wet when you're feeling aroused? Or maybe you're curious why you sometimes notice a feeling of wetness during the normal course of your day-to-day life. While some people naturally produce more vaginal lubrication than others, this wetness is normal in most scenarios, especially when it's not accompanied by any other signs or symptoms that seem out of the ordinary. Vaginal wetness is common when you're feeling aroused, and it's also present when you're not aroused. It's actually normal to produce somewhere between 1 and 4 milliliters of vaginal fluid every day. The exact amount of fluid you produce each day will vary. This wetness helps keep your vagina clean and also provides lubrication to protect against tearing and injury. What is vaginal wetness? Most vaginal fluid is made primarily of water, along with some salts like phosphate and sodium chloride, organic compounds such as lipids and amino acids, antibodies that help the body reduce risk of infections, and old cells from the lining of the vagina, uterus, and cervix. A thin layer of vaginal fluid typically lines the vaginal walls, and it's important for a number of reasons. It provides lubrication that makes sex more comfortable, can minimize or prevent vaginal pain, and even supports fertility. Many different factors can contribute to vaginal wetness. Factors include your age, hormone levels, medications, stress, level of arousal, infections, and perspiration. Arousal. As you become aroused, blood flow to your genitals increases, which triggers the release of fluid from the cervix and the Bartholin's glands, which provides lubrication during sexual activity. Often, the more aroused you're feeling, the more vaginal lubrication your body will produce. Hormones and age. Hormones play a big role in vaginal wetness. Higher estrogen levels lead to increased vaginal wetness. However, as your body produces less estrogen during menopause and afterwards, it may not produce as much vaginal fluid. Sometimes you will feel more wet than usual if you have an infection, such as bacterial vaginosis. The vaginal fluid helps to remove bacteria from the vaginal canal. Infections may also lead you to produce other types of vaginal discharge which will vary in appearance. You will say, "I will suck your body," and "I wet your body." If you say to a woman, "I want to caress your privates," a woman will wet the bed. According to psychology, if a man says to a woman that "I want to adore you," by kissing all these parts of your body, saying something that would make any woman wet the bed. Thanks for watching. Please subscribe, please.